Hello, good afternoon. We're going to go ahead and begin our presentation now. I'm very happy to be here to show you some of our work that we've done at Gallaudet University. We have two centers. One is the Center for Deaf Health Equity, and the other is for artificial intelligence related to sign language. And so there are three of us in the presentation today. I'm Poorna Kushalnagar, and I'm the Director of Research at Gallaudet University and the Director of the Equity Health Center. So we have Ben Kosa and we have Raja Kushalnagar, and he's the Director of the ASL Center. So we want to first thank the National Health Foundation for the funding that has supported this project. Just a brief summary about health equity of access for deaf people. There are 500,000 people who use sign language from birth to adults, and not everybody experiences the barriers to health access, but many, many do experience health access barriers, barriers in their communication, barriers to get information about their health, primary medical health, and the health providers, care providers, people who can work with people who use ASL. And other than the barriers, there are system inequities that are created as a result of lack of proper providers for that and people that use ASL or are familiar with the deaf culture. I'm going to move to clinical trial research, and that's the focus of this particular study. Clinical trial research is often funded by the National Science Health Foundation, and they do work on drugs and on health and on treatments and medications, and they tend to focus primarily with people who require English competency to be a participant in the program or to provide consent. That's always done in English, and that tends to cause a problem for education of deaf people who use ASL, but it's not only that, it's actually any person who uses any language other than English. So for a situation where we needed more funding available to find an equivalent accommodation, so specifically for people who do use ASL. So the lack of inclusion of people in this group and the lack of resources for the group make even more situation where deaf people are excluded, and then the PI, who's the primary investigator, so it becomes harder for them to find the resources that allow them to include deaf people in their studies. So in 2021, the Center for Deaf Health Equity applied for NIH funding to fill the gap, to produce resources, accessible resources, so that the PIs could take advantage and could include deaf people or people who use ASL in their studies. So there were three aims within the research. The first aim was to gather the data, qualitative information from deaf people in focus groups, and to involve them in trials and not to exclude them from the trials, and to collect information about their experience. We also gathered survey responses from the CRC and the PIs about their particular knowledge, their comfort level to include deaf people within the patient study. And both of those were a data set, and they had a common theme. And the common theme helped drive the PI to aim 2 and to develop the app. Now, the development of the app was focused on a user-centered approach, and Ben Kosa is going to be talking more into the actual app. So the third aim is next year, and that's our evaluation with the PI and the CRC and the deaf people who are involved. So let me turn it over to Dr. Raja Kushalnagar.
So, informed consent in ASL, we've thought about extending our previous work on making information equitable in English and ASL. We've had previous work done here, and we've presented here the work that we've done. We presented both sign and English in a transcript form, and it was very successful. And we also added a new, we added machine learning and identification of signs in limited domains. Those two methods, one is through navigation, and the second was through signed consent. Both are very easy to do in English, in apps that all people are aware what to do, and how to do that. And so doing it in ASL is a new thing. So we partnered with programs under the National Science Foundation. And we have different programs that we do with undergrads, and they come and do research projects. And Ben will explain later, and he's an undergraduate. Where our main goal is, what do deaf people want? Do they want ASL or English interactability? So to answer that, the analysis of these two different methods, first, how do we improve the understanding of giving consent, either through video or interaction? Also, improving the fluidity of interaction in ASL, to be able to code switch between English and American Sign Language, and it will reduce word friction with the interactions. So as you see from the two images that are on here, the first image shows the navigation. The second image shows the consent via fingerspelling. Now I'm going to go ahead and turn over the rest of the presentation to Ben Kosa, that has done a lot of amazing research and development of this app.
Thank you. For our pilot study this past summer of 2022, we developed an ASL accessible consent form app. Using two languages, we use Swift UI, and that's an app which is used by Apple to make apps, and we also used Core ML, which is an Apple-based machine learning library, and we used those for developing our ASL interactability. And that's the ASL navigation and the ASL signature. Our design was based on the Apple Research Kit. The Research Kit is basically a framework to develop any researcher who wants to develop an iOS informed consent app. Now, for our pilot study, we developed two different versions for the app for our testing purposes, the A and the B version. A had English interactability, and what that meant was the participants could use a button, and that would be their navigation tool. If they'd push a button, it could take them to the next, or it could take them to the back, to the prior one. And then for their signature, they could actually write their signature, and that was the traditional method for showing consent. Now on the ASL interactability, which was our B version, what that meant was, instead of the button to navigate, they would use sign language for the navigation. So I'll give you an example. They might sign the sign for yes to the camera, or next, or back. And for the signature, instead of writing the name, the participants would actually spell out their full name. Like for me, BENKOSA. So that would be the equivalent to consent. We tested our app with 15 participants, three requirements. They had to be deaf, they had to be people who used ASL, and they had to be over the age of 18. Our app evaluation interview with participants was done on Zoom. Now, for each app evaluation with the participant, we had a 3-step process. First, I would do a screen share with the participant, and I would show a live demonstration of the app. When that was completed, I would then ask a total of 9 different HCI, UI, UX, user experience questions, and then we'd open for discussion. I would ask them, the participants, for their feedback. After we gathered the data and the responses, we did a statistical analysis. We found that the participants' response for the English interactability and the ASL interactability were pretty similar. During the feedback, 10 out of 14 participants felt, well, what they said was that the ASL interactability helped motivate them to be more involved with informed consent compared to the English interactability. The participants felt the ASL signature of spelling their total name was a little bit cumbersome. Now, with our prototype, as displayed, there was the ASL content on the top, and then there was a navigation tool below. And that was a camera that gave a self-view to the person taking the test. Now, deaf-blind participants in our group, and also supporters or advocates of the deaf-blind people, took a look at this layout and the self-view, and they felt it might be hard for a person with low vision to participate and to see it. And they encouraged that we add some kind of contrast or some kind of outline to that screen to help a low vision participant be able to identify what they should be looking at to navigate. Now, our study was not perfect. There were a couple of limitations. For example, our sample size was very small. All the participants were college educated, and the majority of the participants were white. Or in other words, we didn't have much representation for the black and brown signers. Now remember, we were evaluating on Zoom. So Zoom itself has limitations. For example, a participant could not test the app themselves. And sometimes the screen would be too small for the participant to be able to maneuver. Sometimes their inability to see could impact the results. After the pilot study, we felt that ASL interactability had potential. Since our pilot study, we have made quite a few improvements from our original prototype. Instead of making it for an iPhone, we have developed for the iPad the app. And now we show the ASL content with M3 UI, And I'll go more into what that means in the next slide. ASL navigation and ASL signatures we combined into one process, and that meant instead of an individual spelling their full name for the consent, we made it simple, and the person signed consent, and that was equal to a signature. Now, Core ML is not really a good match for sign language. It doesn't do it exactly as it needs to be for ASL interactability. And in the future, our plan is to use custom machine learning architecture for ASL sign language recognition. So again, our current design follows the multimodal visual language user interface. And that's shortened to say M3UI. And that's put on top of Able Player. And so the M3UI, upon development, it was found that the deaf participants liked the ASL video to be with the English transcript. And also the M3UI has the ability to add auto-tracking, highlighting. So this means that as the English transcript is there, the sentences are highlighted that correlate to the video message. Also, we added a speed control, meaning a person could speed it up or slow down the speed. We're going to show you now the current design of our app.
Above me, you see the different parts of the videos. To my left, here's the video transcript in English. When I sign, the corresponding text in the transcript will be highlighted in yellow. In the bottom right corner, you can change the video speed either to slow it down or speed it up. In the bottom of the left corner is the referral button. At any point during the video, you can click on it for more information. Today, you are in the hospital to receive treatment for hypoxia. Your doctor has already created a treatment plan to support you. You are invited to participate in a research study. It is up to you if you want to participate or not in this research. Dr. Frederick Duprez, the clinical trial investigator, works for the Hospital Epicura ICU intensive care unit. His research team is conducting research on hypoxia. Hypoxia is a condition where there is not enough oxygen in the bloodstream. Hypoxia is very common in the United States. Before you decide, you can talk to anyone you feel comfortable discussing the research with. There may be some words that you have never seen before in the upcoming informational videos that you will view. If you happen to think of a question at any point in this process, you can ask anyone on the research team and they'll be happy to answer and discuss any questions with you. Your doctor has created a treatment plan for you. This offer to participate in this research is study. And we're skipping along now. Now this is the signature. You have watched all of the informed consent videos as well as had the opportunity to have discussions with the research team. Next, the research team will ask you if you do or do not want to participate in this research. If you would like to participate, you must sign this exactly to the app, consent. If you do not want to participate, you must sign this exactly, stop. The app will recognize and record your response.
Now for our future work, we want to test our app again, this time with a more diverse sample. And what that means is that we're going to need more ASL dominant signers. We want more racially and ethnically diverse group. We want more deaf-blind participants, more people from the grassroots community, more representation from the LGBTQ plus community, and really in general, just more participants. In the future, after we have completed the evaluation of our app with the deaf participants who use ASL, we're going to use RE-AIM, which is the model of evaluation for the Informed Consent app with our PI and those who conducted the clinical trial studies. Now, for the ASL interactability, the way that we developed is that we use technology called sign language recognition. So this technology is the foundation of speech to sign and sign to speech technology. There are two different kinds. The first is on a word level recognition, and it is abbreviated WLSLR. And that means that in the machine learning model, it's able to take a video of one sign and translate that to English or to whatever spoken language. And then the sentence level sign language recognition is a little bit more advanced. The machine learning model absorbs and takes in a signed sentence or a paragraph, understands it completely, and then translates it to its English or other language equivalent, meaning by meaning. So it's not word by word. The sentence level translation, this kind of technology it's very common in translation technology. For example, Google Translate uses that sentence level translation. In our app for ASL interactability, it's on the word level or the sign level recognition. So what that means is there's a machine learning model or what they call a classifier where it takes the sign from the video, translates it into an English or other language word. And the pictures on the slide show you here. It shows one sample of how the flow works. In our app currently, we're using Core ML for sign language recognition. Core ML isn't really a good compatible sign language app. There are a few problems. It only recognizes one hand at a time. So a lot of signs use two hands. So that doesn't really work. Also, it has low accuracy. So in our future work, we want to transition to use custom machine learning model for sign language recognition. And one example is here, the i3D. There are quite a few different models out there, but this is an example of one that works. And the reason that we'd like to use a custom sign language recognition algorithm is to improve the accuracy and to include more signs and more actions in our app. So that's our presentation. Are there any questions?
Hi, yes, I have a question actually.
Oh, yeah, you can come stand up here if you want. Come stand up on stage.
Okay. Great. Thank you. Fantastic presentation. I was so enraptured, and it's so important. So really, I was a background research on sign recognition related to a lot of the work that you were talking about. So it was fantastic. So I really want to agree that it is critically important that we have both. Hold on just a second, I need to move over. Yep, I did. Yep. I have a background a long time ago in sign recognition, so I just wanted to ask a question related to that. I do agree that it's a very valuable false negative is low and its false positives are low, so it is to make sure that we have all the learning happening in the precipitation and the exactness and the recall. So I want to ask you, what kind of percentages were you considering as acceptable?
That is a good question. I haven't really fleshed that out yet, and it's really not high enough to reduce false negatives and false positives. So if participants sign yes, and they really did sign yes, but the exact percentage, I'm not sure about that yet.
That is very critical to consider.
Absolutely. I will make a mental note. It's our model to have high enough accuracy to deploy it out into the world. So we want to make sure we do have that high enough accuracy to deploy it. I do want to add, if you design an interactive, you eliminate the false positives. If you're signing yes, when you didn't, you can go back or you can go forward. So that's something that's built in to deal with errors. But obviously, to reduce the frustration, we need to reduce those two things. With the testing that Ben did, there was very minimal frustrations. But then we handled, we will have a more diverse population the next time, different backgrounds, different skin colors. That's a very common challenge in identification.
Great, thank you so much.
Any more questions? Yes, you.
Hi, thank you. Very, very interesting presentation to me. Of course, the machine learning part of it is fascinating. My question is more around the signature. I can see that this would have, oh, yeah.
Can you lower the camera onto the interpreter?
We're working on it. There we go.
A fascinating presentation, thank you. My question is around and I can see that it would have many applications outside of this informed consent in a hospital setting. My question is around, have you thought about how that signature would get recognized, the ASL signature? For example, if you're signing, future application maybe for a loan, or that there might be a method of standardizing that acceptance?
I can answer that one. Yeah, I can answer that. In cases where the electronic signature is acceptable, it would be acceptable as an ASL signature. In a situation where an actual signed signature, it would not be equivalent to an ASL signature. And it would depend on the location, the rules, the regulations, ethics, legalese for AI, IRBs. They have oral consent for those who can't sign on paper. Those could be used for signed consent. For IRBs, I would assume they have similar rules in other locations, but depending on the facts of the domain. Any other questions? Did you have your hand up?
He said he just answered my question, so I don't need to ask it.
I'm curious about. My name is Ted Drake. I'm from Intuit. I'm curious about the video of the person signing that's representing what was on English on the side. Part of the problem you're solving is a lack of resources in some areas. So I'm curious about how they would get the video of someone signing for that. And do you anticipate that there's technology that if you have English that it can auto-generate a signing video that would be representative?
That can be done, just a second. You're not on camera. You're fine. I'll work with you. Oh, okay, thank you for that question. We could do a contract with Gallaudet University. Gallaudet University can provide that as part of a service. We can do a signed translation for you. That's simple, that can be done.
Yeah, it's totally fine. I just got my 10 steps in, so I'm happy to come up here. Perfect. I was really... Can you move this way more? Okay. Oh, okay. Not sure where the camera is. Okay, go ahead. I was curious about the ASL signature. Do you keep that in a file somewhere, so someone's finger spells their name out, and then is it kept on file for future use? And if so, then maybe they don't want a face on their signature. So I'm just wondering how that is saved.
Ben,
how that's
you want me to answer that? Okay, go stand on the X, Ben. So that's a good question. To my understanding, an ASL signature, assigning I consent, that will be recorded into a secure database with the PI. Privacy, we can partner in the future, possibly plan to partner with other researchers that have done research in sign privacy, and maybe add that privacy to the consent process. The PI have access to all identifying, you go over there. The PI will have access to all the identifying information, so only the PI could access that. But if privacy becomes a concern that others can see, we can apply filters. You've been involved, Raja, with that work. Yeah, there was a presentation this morning about there are other researchers, many other researchers and programs that are researching ASL privacy, and that's still an open question right now. It's definitely very important. And there any other questions? Oh, one more question.
Do you mind if I just ask one more question? Okay. I kind of wanted to follow up what the gentleman from Intuit talked about. So if we have an English script and translating it automatically to ASL, we have a professional translator, a human person do that. It's not something that's, automatic or something. But do you see in the future having AI that could do that?
Nope, you go back. You go back. We've got you all set up. You guys are good. So yes, I do foresee. What's wrong? No, what? Oh, I'm right here. I'm in this screen. Oh, that's for the live stream. Oh. We're good to go? Okay. All right. I think we're good to go. So that is a good question. Yes, I do foresee that we'll have automated sign translation from any spoken language to signed language. And maybe in the future, we might have one sign language translated to another signed language. That's what I can predict. You can apply an avatar to it potentially. Yeah, and we do have a potential for a signed avatar. So we could have, for example, text. I could submit it to put it in a computer, and it'll translate it to sign, and it'll make an avatar to sign the text. And that's something that is possible in the future. That definitely will require an intensive study, and there's a lot of funding that needs to be done to do that, to make sure that there's an accurate, the acceptance is high, people understand. We're talking about the consent process is making an informed consent. We want to make sure that information is on point. It's not an easy task, but the potential is there. The sign language, there's less resources, there isn't enough data, but we do have emerging curriculums and emerging ways to automate translation, and there's a presenter here that's working on that and got a $25 million. It takes $25 million to build a proof of concept for a sign language translation. So there's more work to make that reliable, trustworthy, and legal. So, I mean, even today, automatic speech recognition isn't equivalent to captioning because there's lack of the human element in that system. Also, just for a little bit of context, right now, I believe you're familiar with speech to text. Speech recognition technology for sign recognition technology, that's about 10 to 15 years behind speech recognition because of the low resources. And right now, word level sign language recognition, it hasn't been perfected yet. It's still being developed. The research is still being done. Work is still being done on that. And then once it's accurate enough, then we can move on to sentence level sign language recognition and develop that and do some research to improve that. after that's accurate enough, then we can apply it to translation. So in closing, this is a perfect use case because it requires high quality information capture by people that are doing informed consent and signing informed consent for participants. So there's funding that's needed for this also. And Poorna, how much time do we have left? It's been 43 minutes. Okay, so last thing, but thank you for so much. I'll be happy to talk with you afterwards. Thank you, interpreters. Thank you, everybody.